Okay, so the next section, it asks me to explain how I'd modify the various exercises we've done for clients with different health problems. In the first one, a client with high blood pressure, I would make sure that there was a pretty long warm-up, longer than normal perhaps, 10-15 minutes, to gradually increase their heart rate. I would make sure that they were breathing constantly all the time, never holding their breath. I would avoid any isometric holds. I would avoid anything that involved them putting their arms above their head or putting their head below their heart level. So that would probably mean in the case of this session that I wouldn't do the press-up fitness test. I would modify the testing, probably not necessarily testing against norms. We could do some kind of low-intensity step test for cardio fitness where their work rate was fixed and I knew they weren't going to be going more than about 60-70% of maximum heart rate. So that's client with high blood pressure. Client with, I think I've covered everything there. Client with lower back pain. I would avoid any kind of heavy weights overhead. That's the other thing about the client with high blood pressure. It would keep the weights very light, so the repetition's quite high. Low back pain, no heavy overhead pressing or anything like that. And depending on the nature of the injury, if it's chronic back pain and the person's trying to improve their condition, I would get them doing lots of work to work their remember the name of it, transverse obliques. So lots of kind of pushing the lower back into the floor, leg raises, but just a very small movement to tighten up that kind of area. So lots of work on the abdominals. I would avoid any plank or hover work because that can put a lot of stress on the lower back. Would avoid, in the case of this session, probably wouldn't do the bent over row. I would do, depending again on the severity of the back, possibly single arm row so that they were supporting their back, they're not so much strain on the lower back, or use a lat pull down machine. So that's client with lower back pain. And shoulder injury or knee injury. Shoulder injury, I would again obviously not perform the press up test, and in the case of it, probably not do the dumbbell flight if it's a shoulder injury that's a rotator cuff injury. With any joint injury, I wouldn't injure through it. I wouldn't exercise through any pain. But once the pain is gone, to try and develop a bit of strength and flexibility, we do kind of chest exercises, but possibly get the client lying on the floor so that their elbows could not go too low, so they're not putting a strain on their shoulders. Make sure that their shoulders are packed and they're not letting their shoulders come up when they're doing any pressing movement. I guess that's about it. Lots of stretches, shoulder flexibility work. But again, for the purposes of this session that we've just done, I wouldn't do the dumbbell fly at all. I would get them doing some sort of work on the floor with the bar and not putting any pressure on the shoulder, if any shoulder exercise at all. I think that's it. It was a bit garbled, but that was it.